Well, I appreciate you coming, really.
I've never done this before, so we'll see how I do.
Well, I thought you guys worked like a really crazy schedule.
We do, yeah.
What's the shifts normally like?
In terms of whether 10-hour shifts and anymore, since COVID it picked up, but honestly, since the eclipse, it's
Hmm.
crazy busy all the time. The normal ER doc sees about 2 people an hour, but I mean, from 6 to 10, I saw 18 people myself.
Today?
Yeah, and that's pretty routine anymore. Usually Sundays and Mondays are our busiest day, but now it's every day is busy, crazy busy.
Even two an hour, I feel like is. I mean, that's 30 minutes a patient. So I mean, you're
Yeah.
still moving.
And the thing is, you don't just have those 2 people. That's just the two you picked up that hour. You still have people that are still hanging around, you're still doing stuff with, which is why patients don't understand. Like, I only saw the doctor twice or maybe 3 times. Well, that's because, I've got 12 people and I'm getting pulled this way and that way, every 5 seconds with different questions and things to do.
So what goes on behind the scenes when you're obviously you deal with a patient and then maybe they tell you their symptoms, you go away, you talk to the nurse more, or
So typically it depends on the scenario. So if it's somebody who's really sick,
Mhm.
you stay at the bedside and take care of them. If it's somebody who's not, they're there for say abdominal pain or just routine chest pain, you tell the nurse what the plan is. You go back to your desk, put the orders in, put for the test, the x-rays, labs, medicines, that kind of thing. And that doesn't take very long. But typically for an ER doc, you get stopped. So from point A, seeing the patient to your desk, you'll probably get stopped 3 to 5 times. And hey, can you take this EKG? Hey, she wants pain medicine in room so and so. And then you get a phone call from the radiologist. You get a phone. So I mean, you get interrupted a lot, which is why none of us have long attention spans. So if you try to tell a story to one of the docs in there and it's longer than 10 seconds, they've tuned you out. It's over.
they're just going to be like, okay, all right, well,
Yeah, that's
let me go
exactly.
talk to your nurse. And because I've always been curious, just as a patient, when you go in, like, I can understand why it's structured that way, but with you clarifying it that like that, it makes a lot more sense. And I have seen just obviously being around hospitals and with the work I do, just kind of the tug of war that goes on with doctors and I've noticed a lot more PAs.
Yes.
Is that do you yeah, I guess is there going to be a shortage of doctors just because the PAs are doing their master level stuff and they're done pretty much?
So I've said for about 5 years, at some point, somebody's going to realize, why do I need all these doctors? Why can't I just have one doctor on staff and have PAs? They're going to save a lot of money doing that. And depending on the PA, like the PAs we have are just really, really top notch. They all
Mm-hmm.
are. And so emergency medicine last year and this year in the match for residency, they didn't match all their spots because people are leaving, are not going into emergency medicine anymore because there was predicted there's going to be an overstaffing of emergency doctors. And so now nobody's going into it. And so the next in 5 years from now, there'll be a shortage of ER docs for sure. Board certified ER docs. So where you do your training in emergency medicine and then you take a test. A lot of people will set up shop. They just do family practice. They just set up shop and do emergency medicine. To me, it's just crazy because, what if you get a kid that comes in, a baby's in cardiac arrest, and you're a general practitioner? You're not going to know what to do. I mean, you're just not. And I've heard docs say, well, that doesn't happen very often. Well, no, but it does happen.
Oh, well, I mean, you got to be a I mean, I would say you got to be prepared for that
That's
possibility.
right. That's exactly right.
So,
We've had a lot of pediatric codes at the hospital. A
oh
lot.
yeah, I mean, mm, yeah, and that's just a delicate situation all around. But and that kind of that was what reminded me of something. Like, how do you guys, when you're going through school, you decide, hey, this is what type of doctor I want to be,
Sure.
and
So typically, the first branch point is I want to do some type of surgical procedure or I don't want to do surgery. And the next branch point is I want to work in the hospital or out of the hospital. So I want to go into general surgery or vascular surgery or OB-GYN versus not anything else. And then do I want to work in an office like internal medicine, pediatrics, family medicine, or do I want to be hospital based? Those are the two big branch points you do. Like when I went in, I wanted to do orthopedic surgery and sports medicine, but I hated it because it was literally hammering and sawing in the operating room. That's what it was. I mean, they were chiseling bones, and it was just kind of brutal for me to watch, so I just didn't really like it. But I really liked emergency medicine. And I did 2 residencies. I did, at the same time, I did internal medicine and emergency medicine. And so if you want to specialize in, say, cardiology or GI or pulmonary, you have to do an internal medicine residency first, 2 years, and then you do a fellowship, which is a year to 2 years. So I did a total of 5 years of residency. I didn't specialize. I wish I would have now. I probably would have done pulmonary or not general cardiology, but I would have done like I just drew a blank. Electrophysiologist, where you'd study arrhythmias and whatnot. If I did it over again, I'd do one of those 2 things.
Oh yeah, yeah. I've been having heart palpitations.
Have you?
Yeah, they can't figure out because like on EKGs they don't show up, and then what is it?
You need a Holter monitor
Yeah,
to wear around for like 30 days.
that's what the NP told me. I was like,
Why didn't they put it on you?
she's like, yeah, go buy one.
Go buy one.
I don't. Yeah, they didn't give me anything. She was just like, well, it's just like a little, just a 1 second, just little. I'm like, oh,
That's probably a PVC. When you feel like your heart just like kind of stops for a second, that's probably a PVC.
well, I cough too sometimes.
Yeah. And you can have PACs, which is the top part of your heart that beats fast or early, or the bottom part. The top part just feels like you have like fluttering, but where you feel like just a jolt, that's usually a PVC. Doesn't necessarily mean anything bad. They used to treat those with antiarrhythmics, but they found it was killing people, so they quit doing that.
Okay.
And just put you on a little bit of dose of beta blocker.
Yeah, as I say, I don't have any symptoms or anything, but yeah, no, it's just you mentioning the studying of arrhythmias. Yeah, so I got to backtrack. How long does it take? Like, say, like you, well, I don't know. Did you graduate high school? How did you? What was your story with that?
So yeah, I graduated high school, and then I went to.
I mean, I'm sorry. Did you go straight into like? Did you go straight into college after
Yeah.
high school? Okay.
Yeah, I went from high school straight into college, and when I first went, I was studying athletic training, sports medicine, and I got into the program there. But I just didn't like it. It was kind of boring. It was just taping a lot of this or that.
Yeah.
And so I got bored with it pretty quick. And so that's when I decided to go into medicine. And then after college, I went to medical school for 4 years and then did 5 years of residency in Chicago.
So how long does that take from start to finish?
Post high school, you have 4 years of college, 4 years of medical school, and then I did 5 years. So that's 13 years.
Damn.
Some like a neurosurgeon who specializes in subspecialty neurosurgery, their fellowship will be like they'll do 2 years of general surgery and then another 5 to 7 years in fellowship. I mean, it's a long time. So that's, you're talking 17 years of training, college and then med school and then fellowship.
So 13 years altogether.
Yeah.
If you could go back, or if you had to do it all over again, would you?
Would I do medicine? I wouldn't do emergency medicine just because
It sounds like a lot.
it's rough on you. Like I'm almost 60 and you're going. And so I would probably pick something that wasn't quite as fast paced and something more that I could hone in on. Like I've been doing this so long now, I feel like I'm pretty good at, telling if somebody's sick or not sick. But yeah, I would definitely I'd probably still do medicine. If I didn't do medicine, I was really good at math. I would do mathematics, or I'd want to be like Indiana Jones. I would.
Go around and try to find the
Artifacts and whatnot. Yeah.
I'm sure they're out there.
I'm sure they are too.
Yeah, you got some trips planned, so maybe you could go.
Maybe we'll see.
Indiana, you got the Indiana part down already.
Yeah, that's right.
Yeah. So how long does that, or not how long did it, how much would you say that it costs? Like a medical degree? Because I know like some people are like, well, I would have been a doctor, but.
Now it's astronomical. It's astronomical. You're going to get out owing $400,000 to $600,000.
Oh my God.
I got out.
Much.
I owed about $135,000. That included college and medical school. So, and I worked for 4 years, didn't go anywhere, didn't buy anything, and paid that off. But some of the docs are like, one of the docs, he's 5 years younger than me. He's still paying his loans off. Yeah, it's astronomical.
So it's kind of like you hunkered down, whereas he's like, I'm going to live life and just pay off less and just let it go longer.
Yeah. But if you go into medicine now, I don't know how you would go into family practice or pediatrics because they pay the lowest. I mean, you could literally make 125,000 a year doing pediatrics.
That's not that. I mean, for a doctor, that's not.
Not when you owe 500,000. It's not.
No,
And then you're getting married. You need a house. You need a car. You got kids. You need college. I don't know how you would make it on that.
no.
Yeah.
So, how did you get used to like? Do you guys do like cadaver labs and stuff like that?
Yeah. So the very first day of medical school, we have anatomy, and we're separated up into groups to our cadavers. Well, you had to take the skin off.
Mm.
So I'm there with the scalpel pulling the skin off. I'm like, oh my heavens, I can't do this. And then I'm like, well, you better suck it up. And so after that, I don't know why that bothered me taking his skin off, but after
I
that,
could see why that would bother you.
okay.
I could see that.
But after that, nothing really bothered me. Like blood and guts, none of that really bothers me.
I feel like most people have the one thing at
Yeah,
least. For me, it's probably I don't know if it would probably be fecal matter or snot.
Yeah.
Blood doesn't bother me.
Yeah.
You know, I mean, I think most people have that initial ooh,
Sure.
and then like in my line of work, we see like a bad wreck or you see a bad situation. That initial shock does kind of you're like, oh man.
Yeah.
Now, obviously, I haven't been around that kind of stuff near as long
Yeah.
or as involved as you are, but I feel like, yeah, I got the one. I don't know. I guess there's just that one thing or maybe two things that you're like, you're not gonna like it, obviously.
No,
But
but you once you see it enough, you get used to it. I mean, I worked in Chicago. I trained there and I worked there, so I saw a lot of
I was gonna say,
gang stuff, a lot of gunshots, a lot of stabbings, and I was in Iraq, and so I saw not a lot, but I saw several IED injuries, which were just horrific injuries. But you just kind of get used to it.
yeah. Well, and like you said, you're in a different mindset where yeah. What happens? What happens? Is there a possibility where guys get in and they do, I don't know, a year or two of residency, and you're like, I can't do it.
Mm-hmm. Yeah. Yeah, there's people that do that. And some people I know in our emergency medicine residency, some people are like, yeah, I can't do this. And they switched out and did family practice or something.
So they still stayed in the pipeline, I guess. But.
Yeah, they did. Yeah, but I know when my very first month, I did a year internship and then I did a month of trauma and then a month of peds. And my first job as my first emergency department as a resident, and it was just, I was ready to quit because there was a house fire. 5 little kids died all at once. And I coded 2 of them. And the same day, the exact same shift, this lady got into a car accident. I had to tell her mom died. And nobody trained you for that. Nobody taught you how to do that or how to process that or deal with it. Yeah, it was stressful.
It is very tough. You wouldn't think it, but it is super tough to tell someone.
Oh, it is.
Gosh, it's awful. And
Yeah.
I'm surprised there's not a training on, hey, listen, you're in a situation of authority. You're in a position of authority and the family wants to hear, I want to see the doctor. I want to see the doctor.
Yeah.
So you're the final end.
Mm-hmm. I suspect there probably is training now. I mean, I would hope. I don't know that there is, but I would hope there is because there's no easy way to do it. And I've learned that what I do is I let them see me sad, upset, so they know something's coming. I don't just walk in there and say, I'm sorry, but he died. They know something bad's coming. They can see it on my face. And it just kind of helps soften the blow a little bit. And then I've also learned you can't say they passed away. Because in Chicago, a lot of people, what does that mean? Does that mean he's dead? You had to spell it out sometimes with people.
Yeah, and I guess so I had similar training, and it was like they kind of have this mental safeguard. They go into denial. So you say, like, one of them was like where a police officer knocked on the door. It's not funny, but it was like she was like, I think it was a dramatization. It wasn't a real. But she's like, he's gone to be with the Lord. I don't remember.
Yeah.
And they're like, obviously it means he's dead, but it's like the way, they're just like, we just want you to say XYZ, he's dead.
So I remember it was in Chicago, and this younger guy, he was 19, he got shot, I don't know, 27 times. And, we couldn't resuscitate him. And I went to tell the mom and his brother, and I walk in and I go, hi, ma'am. She said, are you the doctor? Yes, I'm the doctor. Oh, please sit down, doctor. I said, Okay, I'm afraid I've got some bad news. Okay, doctor, what is it? I'm afraid your son has passed away. And she's like, does that mean he's dead? Yes. And we tried to resuscitate him. She's like, excuse me, doctor. And she says to the young man, who was a teenager sitting on the couch, to him, hey, you need to go take care of this. And then she's, please continue, doctor. And so there wasn't much else to say. And then she, excuse me, doctor, why are you still sitting there? Get up right now and go take care of this. And he did. He got up and left. Yeah, that's intense.
Yeah, that's yeah. I was gonna say they plan their retaliation right then and there.
And where this particular hospital was in a knife, and it was on the west side of Chicago, and it was you would have stabbings and gunshots every single day, bad ones. Yeah, I remember gang members would just come busting through the door with their buddy. It's all bloody and everything, and they'd throw him on a bed and say, "Get over here and take care of this." And I'm like, "Yeah, I will, man, but you're gonna have to get out of the way because I can't get to him." He's like, "I'm not moving." I'm like, "Well, I can't do anything if you're gonna stand there." Yeah, they used to do that a lot.
Goodness gracious.
Yeah, it was pretty intense.
Yeah, and then yeah, they're all sitting there watching you, or
Mm-hmm. Yeah. And this one, I remember he brought this one guy in and he was holding him, and I could tell, like his legs were just dangling. So I could tell he's paralyzed. And so I'm like, hey man, you got to put him down. I'm not letting him go. I'm like, he's paralyzed. You're gonna make this worse. Please put him down. And he was paralyzed. He got shot in the back. Yeah, he was just swinging him, and his little legs were like a pendulum. Yeah. I mean, I could go.
oh God.
I tell you, I could go on and on and on with stories.
How did so? Is that where you're originally from, or is that just where you went to school?
No,
You were-
I'm from Indianapolis originally.
Okay.
And on the east side, it was kind of a rough neighborhood, and we grew up fairly poor too. And then you probably never heard of Fountain Town, Indiana. You know where Shelby County is, Shelbyville.
Yeah.
It was in that county.
Okay.
So I lived in the city for the first 9 years, and then out in the country for the next 9 years. So I got a little bit of everything.
We lived in good old Hallville,
Hallville,
so it's right by the racetrack. It's over there. It's near Speedway.
where Speedway.
I'm like Allison Transmission
Okay, yeah,
on 10th Street. If you go east of that,
yeah.
real just impoverished area.
Mhm.
Great times. I had some great times there.
Well, I learned a lot.
And and I'm sure you can attest to this. It's like I would walk the dog at because I worked at FedEx Freight. I would get off and walk the dog, and you'd hear the gunshots, and they're like 3 blocks away, and you start to get to the point where like
It doesn't frighten you anymore.
you're just like I think it's good. And then there's sometimes like whoa, that's pretty close, and then you're like okay, I'm gonna start moseying back home, and then but yeah, there's some people, but you know what, I really appreciate those experiences because it really gives you like there's people that can't handle that, believe it or not.
I know.
And I think that it's crazy to kind of understand how sheltered some people are.
Yeah, I really appreciate the time growing up on the east side of Annapolis too, because I grew up tough as nails.
Mm-hmm.
I remember I was a little kid. I got a brand new bike. I was 6, maybe 7, and I rode it. And the next day it's raining. I'm like, oh, I can't ride my bike, so I'll just play on the front porch. And then I see some kid riding a bike, looks just like mine. I'm like, hey, that's my bike. He's like, no, it's not. We saw yours yesterday. We went up and bought one just like it. I'm like, I don't think so. So I went to the alley and I followed him home, and my bike was gone. I saw him put it into his garage. So I broke into his garage and I stole it back.
Good for you, man. Good for you.
Yeah, 7-year-old little hoodlum.
You gotta, you know what though, man? They'll do it to you.
That's
and if
right.
you just let them know that you're gonna be a victim, then
Yeah, that's right.
it's like going to prison.
Yeah, that's right.
Yeah. So, like, what's the future for doctors? Like, when you finally get like, first off, I can't imagine how that feels to finally be done. Like, you get your
Yeah.
degree, So, how are you finding a job? That was like 6 questions in one. Let me start.
Yeah. No, I understand. So after residency, or during the last few months of your residency, for emergency medicine, it's a little bit different. So what you normally do is you decide where you want to live, and then you just call up a hospital there and say, hey, are you looking for somebody? That's all you do. And then you give them your CV. You can also use a headhunter, and they'll charge the hospital. I think back then it was $10,000 or something. And they would try to find you jobs and set up interviews and whatnot.
Do you pay the headhunter, or the hospital pays the headhunter?
The hospital would pay it. But
They're scouting for doctors.
yeah, so normally if you sign on, they'll give you a sign-on bonus. Back then it was 10,000, 5 to 10,000, and so the recruiter would get that instead of you. That's all. But I got a job through one of my other buddies who worked at that hospital,
Mm-hmm.
and then I got a job from there, and then every 3 to 5 years I was moving on either for better money or I'm tired of the just guns and knives all the time.
Yeah, yeah,
I've been here. This is my 9th year now.
yeah. That's a pretty good. I think you get a balance, don't you?
Yeah.
Would you say?
I say this is the best place I've ever worked in terms of the doctors, the nurses, the patients, even the community. Everybody is just really good. I mean, you get outliers, of course, but for the most part, it's not like, in Chicago, somebody's in your face screaming at you. They want a prescription for this and you're giving it or else. This has been a very nice place to work. Very nice.
Yeah. Well, see, I didn't know. 9 years is. How long have you been a doctor?
I graduated medical school in 92. Yeah. And I got out of residency in 97.
You started young. That's good.
Yeah. So if you count residency, I mean, I think I'm in my 31st or 32nd year doing emergency medicine.
Yeah.
Yeah. It's a long time.
I was born in. I'm 33. Just
Okay.
turned 33. So
Yeah.
yeah. I was in diapers when you graduated medical school. Wow.
Yeah. I honestly think I could retire now if I wanted to. I just don't know what I would do.
Say, what would you do?
Right. Exactly.
You
And
could work at Lowe's.
yeah, I guess. And we have a med spa too. I don't know if you know that.
A what?
A med spa. It's so we started out doing Botox and filler, and now we're doing weight loss, lasers. We just bought a new machine that does liposuction. We do hormone therapy, and I'm the medical director, and I do some procedures, but me and 3 of the PAs from the ED, it's our business, and it's growing really fast. So I could probably easily do that, but I might get bored doing that too. I don't know.
So you and 3 PAs run this thing?
It's our business. We have an LLC. Yeah.
No, I didn't know that.
We have our main office in Franklin. We got another on the north side of Indy. We've already outgrown. We opened it in October. Already outgrown the Franklin office, so we're doubling our space starting July. Well, today or yesterday, and we have to renovate this other space. So we're gonna double our space here in the next 2 or 3 months.
I didn't know that.
Yeah, it's just we have 700 patients on semaglutide Ozempic. 700 every month.
700?
Yeah. We have
So
1,200 clients since a year and a half.
you started a year and a half ago, this thing?
Yeah.
This spa?
Yeah.
That spa?
Mm-hmm.
Wow. Yeah, I could see why. I mean, what is it? So that Ozempic, we were talking about earlier,
Mm-hmm.
when did that start, or has it been around for a while?
It's been around for a little while, but it really took off for weight loss once Hollywood found out about it.
Mm.
So a lot of these stars were losing a lot of weight really fast, and so the word got out. And it's for diabetes, but it makes it so you're not hungry, and so people eat a lot less, and therefore they lose weight. It's not an end all, because once you stop it, you're gonna start eating again. So you have to do something. Like I exercise a lot.
Okay.
And I tell people they should do that too. And that normally you'll lose 5 pounds a month. I lost 18 in 4 weeks.
So you're not like, it's not an unhealthy amount of weight loss. It's not like you're just,
Right. Because I lost a lot more because I'm exercising a lot. Like I'm
Mhm.
lifting, I'm doing cardio, I'm doing jujitsu, so, and I'm pretty active at work too, of course.
I was gonna say, you probably walk.
I don't know how many steps I do. I'm sure it's,
Oh, it's probably 5. You probably walk 4 or 5 miles, if not more.
I wouldn't doubt it. I wouldn't doubt it at all.
The hallways are so.
Mm-hmm. That is a big area to traverse. It's not a small little department, for sure.
Yeah. So anyway, yeah. So like, you retire. What would you say most physicians do?
Probably travel.
But do you get like a retirement? It
It's
just depends on where you work.
well, so yeah, so it depends on where you work and if you're working for a big corporation or not. Like we're a small private group, so we have a retirement plan. So yeah, I've got a lot of money saved up in my retirement plan. That I'm very conservative, by the way. Like everybody's got theirs in the stock market. I just know that's going to crash any moment. So
It's weird. The economy is really weird right
I
now, but
know it
I
is.
try to look at it from different viewpoints. But I will say it seems like I don't know. Yeah, that's a whole nother bag of worms, can of worms.
See, you're younger. You can afford to take risk. I can't. I don't want to. I don't want to lose a lot at the end and then have to work a lot longer. I plan on retiring, semi-retiring at age 62, then going to halftime is what I plan. But we'll see.
I have seen some doctors that are probably, and I know you have too, like in their mid 80s.
They just really like doing it. I don't think they're doing it for the money. I think they just
No.
like doing it. There's a doc up in Indy, and I think he's upper 60s. He doesn't work the department anymore, but he goes around and does education for people, which I love to educate too, and I do a lot of it at the hospital with EMS and whatnot. But yeah.
What's the EMS director entail?
So what I have to do is I have to provide them education. So typically I will set up a lecture every other month, and then the other months I set up some sim training where they come in and we do some training. I have to come up with the protocols and make sure they're being followed. If somebody's really messed up and they've not done the protocol or they've done something they should have done, I have to sit them down and talk to them, which doesn't happen very often, but it happens sometimes.
So EMS for like ambulance and the paramedics or
Well, I just found out 2 weeks ago. I forget the captain from CPD. What's his name?
oh Wilder.
Yeah. Uh,
Yeah.
or called me and said, "Hey, I don't know if you know this, but you're our director, our medical director." I'm like, "No, I didn't." I'm also medical director for CPD, the sheriff's department, the school corporation, and all the outlying fire departments, volunteer fire departments. I'm the medical director, and I'm the medical director for CFD for Columbus Fire.
No one tells you. They're just like, hey, it's
Yeah,
it's Guffey. Just
yeah. So now we know.
I feel like there should be a change in your paycheck for that.
There was.
Okay, good. Okay, well
Yeah,
at
there
least there's
was.
that. God,
Yeah,
yeah, that sounds like a lot of different people that could potentially,
liability. Yeah.
well, just and just pull you in. Hey, we got this going on, or hey, we got
Yes.
yeah. So yeah, I don't really know. I think let me check my little. I don't think I got much else for you. I just wanted to make sure. There is one thing I want to ask you about. Uh, we always look at like the cure for cancer.
Mm-hmm.
People want to live longer.
Mm-hmm.
So I know this is more probably a scientist related question, but what's happening as far as in the medical community when it comes to, or do you believe, there's like that conspiracy of they already know the cure for cancer. They're not gonna, what's,
I don't know. I honestly don't know if they do or not. It wouldn't necessarily surprise me if somebody has it, and you know how things work. It's all about the dollar. And I think the key to long life is genes. It's in your genes. And then I think it's how you take care of your body, what you eat, what you drink. I personally think the food here in America is so processed with things,
oh God.
which is why everybody's so overweight. Like it wasn't like that back in the 70s. Nobody was overweight. It was very rare. Now it's rampant.
Well, and I'm 30, yeah, I'm 33. And I remember when I was a kid, and I mean, I could be totally wrong, but it was just like, even then the fast food seemed different. And you see like all these old 90s pictures on Facebook or slideshows and you're like, dang man,
Yeah.
and believe it or not, I used to work for a funeral home.
Uh-huh.
Worked for a funeral home for about a year and a half, and one of the funeral directors told me that he uses, I don't know how much he said less, but they're using a lot less formaldehyde, formalin.
Mm-hmm.
And he's like,
Because they don't need it because the body has so much fat.
well, the food is not breaking down as bad, and so the bacteria aren't. I don't remember how he
Interesting.
described it, but it was almost like
Huh.
organic chemistry.
Really? That's very interesting.
It was, yeah. So I've got a mortician that talked to her. She's gonna,
Really?
yeah.
On my trip coming up, the lady who's kind of organizing everything, she's like, "You will eat a ton of food and you won't gain a thing over
I believe it.
in Asia." Yeah.
Well, so are you gonna take a break from your shot?
Yes.
Okay,
Yeah.
good.
Because I'm at where I want to be now. So
I was gonna say, man.
yeah, I don't really need to lose any more weight at all. So I'm just gonna do another week, probably. That's it, and then stop it. Because I took it, and before I went to Mexico, I stopped 2 weeks before, and I still wasn't hungry after 2 weeks. But I'm in Mexico, so I'm gonna make myself eat.
Say if you go to the Philippines and not eat, man,
Yeah, yeah,
that's
that'd be a crime. That'd be a
well, I
crime.
mean, and yeah, all these other places, like it's just like you said. I think that, and it's crazy. Like I tell people, I'm like, you can go to a high end restaurant in Indianapolis. It's going to be good, but you go to, I mean, it's just like that was one of the things I missed the most about being like in Japan, or you could just tell they did that, or like I mean, obviously I went to like Manhattan,
Mhm.
like places like that where it's just a massive melting pot of people,
Yeah.
and you're getting like the authentic experience
Mhm.
here in the United States. But yeah, I was gonna say you can't go there and not eat, because then that would
Yeah.
that would be a crime.
I'll tell you the thing is I drink a lot of water now. I didn't used to drink water at all. I hated it, but my 10-year-old daughter would only drink water. And so I started drinking water. Once you start drinking a lot of water, you don't really look back.
I like carbonated water.
I do too.
I like bottled water. I mean, I think my problem is the well, I'll, I'll I'll dabble with them, but like diet stuff.
Yeah, that's not good. I do too. I'll have like one a day, but that aspartame is not good for you.
What does it do? Heard it like increases your chance of stroke, and
So some people say their studies have shown that it binds neuronal tissue, and so you were seeing a lot of MS-like symptoms. And I'm not saying this as a doctor that it's true. That some people thought it was part
like
of the Gulf
multiple sclerosis.
like symptoms. Some people thought it was like caused the Gulf War syndrome because all the Diet Coke sat. I don't know if this is true or not, but they have shown that aspartame turns into some chemicals and it binds your nervous tissue, and so. I remember when I was a resident, I didn't drink coffee, but I drank Diet Coke like it's going out of style for the caffeine. But I started having like memory issues, so I quit, and then my memory came back.
So it could cause like memory issues and all the
Mm-hmm.
other stuff. And I'm sure it's not good for your
Yeah,
metabolic system.
no, yeah. If you can stay off diet pop, you're better off for sure.
I have noticed if I'm on an empty stomach, like right now, my stomach's over here growling. If I drink, usually, well, he's probably here, but no, I'll notice my blood sugar will drop.
Yeah,
I mean, I'll get like weak and
really.
shaky just from because your tongue, your pancreas is producing insulin
Mm-hmm.
because your tongue detects something sweet, but there's
Mm-hmm.
no actual sugar in it. So now you're like,
Yeah, absolutely.
body's like, give me sugar.
Yeah, absolutely.
Yeah, I'm sure that's great for my pancreas. But well, listen, I appreciate you coming.
Yeah, it was
And
fun. I had a good time.
oh man, yeah, I mean, so many people looking forward to. They're like, yeah, I've never had a chance to actually talk to a doctor, and quite honestly, I've talked to a few here and there, obviously not to this extent, but and I can see now why, because you guys are getting pulled in
Oh yeah.
17 different directions.
Oh, it's crazy. I remember when the nurses asked me to put an admit order in for a patient that I thought I'd already put in. She's like, nope, you didn't do it. So I went back to my desk to do it, but I got a phone call. I got an EKG. I had a new patient I had to go see. And then she's like, hey, did you put that order in yet? No. So then I put it in, but I forgot to sign it. It's like, it's not in. Yeah, that's just routine. That's just routine.
And they're not allowed to sign for you.
No, they can't. No, it'd be nice.
I guess they could, but that probably wouldn't.
Yeah.
Can you guys prescribe yourself something?
Yeah.
If you're just like, hey man, I'm not feeling good, I need some antibiotics.
Yeah.
Okay.
Yeah. There's no law says you can't. And I do. I prescribe myself Zofran, or I take Propecia for hair loss. I just prescribe myself. Now, I don't ever write for narcotics. I think you could. There's nothing illegal about it, but it just would look bad. If somebody's writing their stuff, Percocet or Valium or something. So I've never done that.
It could be in your health spa.
Huh?
See, you can have that in your health spa.
Well, I know.
Just to give them an IV of,
Well, we do IV therapy there too.
yeah, put morphine in that.
Yeah. Yeah. Not yet. Hopefully we're not going to get there, but
Yeah, the hair loss thing, man. I started taking oral minoxidil. I took the topical for a long time. Not a long time, but yeah, I was like, that's probably where the heart palpitations may be coming from.
yeah.
But then I had to, but then you have to go get a prescription for that, and then you have to get a prescription for finasteride.
Yeah.
And so I told my dermatologist, I'm like, hey, put me on the strong stuff. Put
Yeah.
me on the dutasteride.
Yeah.
He wouldn't do it.
Why?
He's like, this causes, he said the risks, he said, with you not having any symptoms from the finasteride, I'm already surprised. He goes, I don't want to. And I'm like, look, man,
I
listen,
take it.
dutasteride?
Yeah, I started on Propecia, but
Yeah. And I'm like,
now it's
well,
Avodart. I don't have any.
well, he's like, I said, well, you know, like, he's like, well, you're blocking off more DHT and this. And I was like, yeah, that's the freaking goal.
Right.
So for you guys out there, you got, I need to go doctor shop.
I'll tell you what, when I get back from my trip, we're starting a men's clinic, and we'll be doing hair loss.
Yeah, because I used it was either Keeps or Hims. I can't remember which one I used.
Yeah, I started to use that. I didn't like how it left my hair so oily. I felt like hair was falling out.
Well, you got hair. I you know, and I don't mind buzzing my hair down. You know, that was a big mental hurdle for me for a long time. And then it just got to the point where I was like, if I have a chance, if I have an option, which I think most men out there will agree, if you have an option to do something about it, then
I do.
know.
This is transplant.
Oh, you had it. So Turkey is like leading the way.
Really?
Yes. And I have relatives over there that we've been wanting to go see for a long time. They're all older. I mean, obviously my dad was so old.
Yeah.
But they basically have like a package deal where you pay, and it sounds gimmicky, but I've looked at it for a while, and I've had people, or I've read where they take you in a, you know, really nice hotel, and then they do the procedures, and I think it's like $4,000. I mean, it's a fraction of what it would be here with like Bosley or
yeah, they're doing all kinds of, like we're gonna do PRP, which is platelet rich plasma.
Yeah, injections.
Mm-hmm. Yeah.
I do. I've got a pen and I've got the derma roller.
Yeah.
And I don't. Man, that hurts.
Yeah.
Man. Oh my God.
I don't have the pen, but I have the derm roller. I don't use it anymore.
Like that bony, the crown. Right. Listen,
Forget it, huh?
It's like stabbing your shin.
Yeah.
But it's supposed to be really good. You injure the scalp and it like brings it back in. So yeah, I need to check that out because I need to. I've never had PRP injections, and well, you guys prescribe stuff out of there for that,
like we will
finasteride or whatever,
or both of them, and also the topical stuff. Yeah, we're gonna do that, and
yeah, because I've done finasteride since April of 2022.
Yeah,
so a little over 2 years.
Yeah, I've been doing. I don't know how long I've been doing Avodart. I can't say that name, but I've been on it for a while. I don't notice any side effects at all.
Yeah, I had I had some achy testicles for about 3 weeks, and I was like,
really?
Oh man, yeah. And he said that's normal. He's like, you're gonna have, he said, watery semen,
yeah,
achy testicles, and then it went away, and I was like, I mean, completely asymptomatic.
I never had that achy testicles, but
I did. Oh man, listen, it was like
bad, huh? Like you got kicked.
Like you had to just like sit down and breathe.
Really?
Contemplate your life.
Really, that bad?
No, it was probably the first 3 days. I'm like, listen, man, like woke me up out of my sleep, and I'm like hobbling and then like, and the terrible thing about it was ice wouldn't help.
Yeah.
There was nothing you could do. It was just like this, because it affects your oh man, I was reading about it, why it actually does that, but it went away, thank God. And I was like, listen, but I was like, I'm gonna persevere because I've seen some remarkable results from it.
Yeah, it definitely helps for sure.
Yeah.
Yeah.
Well, listen, I'm gonna get you out of here. I really appreciate you coming.
Yeah, thanks for having me.
Yeah, I don't think there's anything else I need to add. So
all
right. Well, that was a good one.
Awesome. Thank you.
You did great. You're a natural.
My first time.